Good afternoon, everyone. How many of you are curious about exploring new and innovative acupuncture techniques that combine ancient wisdom with modern advancements? Please type yes in the chat if you're excited to expand your toolbox with groundbreaking methods. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. At eLotus, we have been hosting educational courses for over 3 decades and are proud to be your trusted source for premium CEU content, featuring over 200 speakers, 700 courses, and 3,000 hours of CE. We appreciate you all for joining us today. It's my pleasure to reintroduce our speaker, Dr. Ying Wang. Dr. Wang is a dynamic figure in TCM, serving as a doctor of traditional Chinese medicine, an attending physician, and a lecturer on research topics such as theoretical basics of traditional Chinese medicine and health preservation. She holds prestigious positions including Deputy Secretary General of the Liaoning Provincial Health and Rehabilitation Society and memberships in various TCM organizations in China. Dr. Wang is also a World-China Joint Medicine Diet Therapy Research Director and an esteemed member of the Chinese Acupuncture and Moxibustion Society. Her research is at the intersection of tradition and innovation. Her dedication to advancing TCM knowledge and practice is evident in her multifaceted contributions to the field. Today's webinar is Mapping Microsystems, Eye and Clavicle Acupuncture, sponsored by Evergreen Herbs. Dr. Wang will guide us through 3 innovative techniques reshaping modern acupuncture practice: Microneedle System Therapy, Clavicle Acupuncture, and Eye Acupuncture. These groundbreaking methods combine ancient Chinese traditions with contemporary advancements, offering powerful tools for diagnosing and treating a wide range of conditions. You will learn their theoretical underpinnings, diagnostic methods, and practical applications, equipping you with actionable strategies to improve patient care and expand your clinical repertoire. Dr. Wang has taught previous courses with eLotus, including Uncovering the Ancient Text of Classical Paired Acupoints and Herbal Formulas, focusing on the best point and herbal combinations, and Baby Tuina, where she guides us through the various Tuina techniques used on babies. If you're interested in diving deeper into microsystems, be sure to check out our extensive series of courses on Dr. Richard Tan's Acupuncture 123. These courses offer invaluable insights into applying microsystem techniques effectively in your practice. And here's the best part. If you're a Gold Pass member, you can access these courses for free as part of your membership. I'll share the link to our microsystem courses along with our 2 other courses in the chat room so you can explore these incredible resources. And before we begin, a few housekeeping items. Please set your chat to everyone to ensure your comments are visible to the whole group. Feel free to ask questions in the Q&A box during the presentation, and remember, the CEU quiz will be available by the next business day late afternoon for those who meet the participation requirements. Now, let's dive into today's topic, and please join me in giving a warm welcome to Dr. Ying Wang.
Okay, thank you for the introduction, Mara. And now we are going to start our lesson today, and I will share my PowerPoint here. So is it clear for everyone to see it?
Yes.
Okay, so let's start. It is 5 o'clock in the morning in my city. It is Shenyang, Liaoning province in China. So I would say good morning, but actually I know most of you, the time in your place is actually in the afternoon. So good afternoon to everyone too. Today we are going to learn the mapping microsystems, eye and clavicle acupuncture. And I am the instructor today. My name is Wang Ying, Doctor of Traditional Chinese Medicine, and I would like to have a short self-introduction of myself. Female, of course, from the parents, born in 1990, doctor of TCM and a lecturer attending physician, Deputy Secretary General of the Liaoning Provincial Health and Rehabilitation Society, member of the Liaoning Provincial Society for Preventing Diseases, member of the Liaoning Provincial Acupuncture Society's Balanced Patch Therapy Research Branch, World China Joint Medicine Diet Therapy Research Director of the Professional Committee and member of the Chinese Acupuncture and Moxibustion Society. My research direction is compilation and excavation of ancient health-preserving literature and the mechanism of sub-health conditioning therapy in traditional Chinese medicine. And my current position is lecturer in the teaching and research section of traditional Chinese medicine and health preservation in Liaoning University of Traditional Chinese Medicine, and giving lectures on theoretical basics of traditional Chinese medicine and health preservation and rehabilitation, TCM and health preservation, and other undergraduate and international student courses. Since I worked in Liaoning, and I'm so proud of the scholars who developed different kinds of microsystems acupuncture in my city. So I'd like to have a short introduction of the development of acupuncture in Liaoning, China. The acupuncture here can be divided into these kinds. The first one is the traditional acupuncture, and it is usually practiced by the filiform needle therapy. It is almost the same as other kinds of traditional acupuncture all around the world. And the second is the special acupuncture, and we can also see this kind of bloodletting on lower vessels in other countries. It helps to expel the heat inside the body out. And also this electroacupuncture, we see so many scientists in the lab to do the animal experiments with the electroacupuncture on the animals to see, to discover the mechanism of acupuncture by it, because it can be controlled at a very specific currency to help to dig out the mechanism. And the third one is what we want to talk about the most today. It's about microacupuncture. You may already learned some of these systems, like the auricular acupuncture, scalp acupuncture, and the wrist and ankle acupuncture, and tongue acupuncture, and so on. And recently, I have read about some essays about the anus acupuncture. And we see that these microacupuncture, they might have some similarities, also including the microacupuncture today I want to talk about is the eye acupuncture and the clavicle acupuncture. So why they all belong to the micro system? Then I want to introduce this definition. But before I introduce this, I want to put forward a question. So many microsystem acupuncture, including the eye, the ear, the tongue, and the navel umbilicum, or you call it, and the hand, the foot, and the ankle, the wrist, and the scalp, and even the nose. So are there any similarities among these parts of the human being's bodies? Or we want to see some scientific provement about why they can have this special efficient therapy in our clinical practice. Then we see some of the scientists, the scholars, actually his name is Li Yongming, who was once the head of the American Society of Acupuncture, traditional acupuncture, that he published an essay. The title of it is The Neuroimmune Basis of Acupuncture, the correlation of cutaneous mast cell distribution with acupuncture systems in human. And he found out that the mast cells are actually something that can be the target for us to understand why acupuncture works, especially the microsystem acupuncture. We can see the picture in the middle that the darker part, for example, the hands and the genital parts, the navel, the nipples and the nose, and around the mouth and scalp, the eyes and the ears and the feet, the ankle. These parts, why it is darker? Because the writer wanted to tell us the mast cells distributed in these parts more than other parts. So this actually gives us some understanding how acupuncture can be understood in a way under the microscope. So the mast cells are some special cells that it can magnify the therapy efficacy when we insert needles into the human being's body. The mast cells will be broken down and excrete some cytokines, which can help the body to enhance the immune function and expel the pathogens. So similarities that we read in the ancient books, that while we insert needles in the human being's body, we are actually to move the qi and the blood to circulate this qi and the blood to help the body keep the balance, enhance the zheng qi, the vital qi, to expel the xie qi, the pathogenic factors. So, in other words, if we can see how the mast cells work in our human being's body, we will understand the acupuncture better. But unfortunately, there is no tools nowadays that can actually detect the mast cells in a living human being's body. So we wish that someday there will be some more advanced technology that can help us to see how the mast cells moved or changed while we insert needles into the human being's body, to see how the diseases are cured by this understanding of the mechanism.